Hi everybody, it's me, Dr. Falguni Patel of Rejuvenate Center for Medical Aesthetics, and I'm back here today to talk to you about volume loss, especially in the face. So as we age, our collagen production definitely slows down, as does the elastin production. And the elements of nature, whether it be diet or the sun, smoking, will affect the strength of our skin and how our bodies age. So everybody's heard of fillers, and that is one of the options you have for volume loss. So volume loss can happen in numerous areas, especially on the face. You may notice nasolabial folds that are starting up here, from some volume loss, lips getting thinner as you're getting older, loss of the volume around the tear trough as well as the lateral cheek and the temples, which people tend to forget, but it tends to cause the eyes to kind of come in. So volume loss can happen in all of those places, as well as the hands and other parts, but most of us will be focused more on our hands and our face. So volume replacement can be done, and the quickest way that most of us know how to do is to do it with dermal fillers, and that's one of the options. Dermal fillers come from short lasting to long acting, from hyaluronic acids like Juvederm, Voluma, Restylane, to long-term stuff like Bellafill, which is a bovine collagen. Which is the right filler for you really depends on what you're hoping to achieve and the risks you're willing to take. Often people come in and say, yes, I need fillers here, but actually look at your face overall. I mean, here, look at me, I'm in my mid-40s, and you can see as I'm losing volume, and volume loss, by the way, happens not just with aging, but weight fluctuations. You know, when I'm chunkier, my face is fuller, and when I'm trying to lose weight, well, my face sucks, so what are you gonna do about it? So when this starts to happen, the reality is that most of us can use fillers in the mid-cheek and lateral cheek, because it's kind of like pulling it back like that. Just think about what the plastic surgeons do when they're trying to help correct your aging. They're trying to do a facelift by going laterally and above. So when you're doing fillers, how does it make sense to put volume right here and just make your face a lot more poofier lower down? So the reality is, I like to treat my patients with mid-cheek volume replacement whenever possible. So usually lateral along the zygomatic arch and mid-cheek right around here. That helps pull stuff back, especially the nasolabial folds. And when you correct the cheeks and maybe a little tear trough, your smile line pulls up as well. So it's more of a natural way to kind of add volume. Besides dermal fillers, the next two things that most people don't think about is, one, fat replacement, and fat is done through liposuction fat harvesting, where you can put in your own natural fat to replace the volume. It's a bit more complicated because you have to go possibly under some local anesthesia, get some liposuction, and then hope that the fat is harvested properly and then put back into the face. But it is a nice way to get the volume back without putting anything artificial or exogenous into your body. And the third one, which is kind of becoming very popular, which is the PRP, or I think also known in the media as the vampire lift. What this is basically platelet-rich plasma. When it's activated with some calcium chloride, it will make this matrix, which is going to allow stimulation of the growth factors within it and allow collagen and elastin to build up. So if you're really, really scared about putting something into your body, such as a hyaluronic acid or a calcium-based product, or even the Bellafill, which is a bovine collagen product, but you definitely need volume loss, and you're one of those skinny, you know who I'm talking about, where you just don't have enough fat to liposuction out of anywhere else, you may want to consider the PRP, because that's a natural way of getting volume. It's just a longer process, so you may require multiple treatments and a lot of patience to get that volume into the face. But all three of these options are options to help kind of keep yourself youthful. So I'm looking forward to the near future as I put in some volume here and here, and which way am I gonna go? I'm not quite sure. I have a lot of fat on my ass, so I guess I can get some of it out from there, but I also have good healthy blood, so I guess I could do the PRP as well. And if I really needed a quick fix, then the dermal fillers are always there for me. So I hope this quick little tutorial helped, and if you have any questions, definitely stop on in and we can help you answer those questions. All right, have a great day. Until next week. Bye.